Hey, welcome to MTN Update. I'm your host, Pam Colby, and I have a very special guest here. We're up in Studio B at the Minneapolis Television Network, and we're actually live, and if you'd like to text or send us an email, you can do that. Today, I am here with Marido Huber, and Marido and I go way, way back. And Marido and MTN go way, way back. And most recently, Marido has served on the board of directors and as the chair of the board of directors at the Minneapolis Television Network. But before that, many years before that, she also was a producer and a staff person at MTN and started one of the first shows on the music scene.
Yes.
Welcome, Marido.
Thank you, Pam.
So let's go back to the early days and
that would be
when you first remember coming to MTN.
That would be 1986 at the Lehrman Center. I was finishing my associate degree in media production down at the community college. And I heard that you guys were opening, MTN was opening, so I went there and asked if I could do a free internship, and they said, sure. And I mean, we literally opened the boxes and took out those brand new, enormous 3/4-inch deck and built MTN. I mean, and there was nothing, and we had to build everything. And I see there's still some of them left out over here.
The 1986 equipment, and a few of them are still, but they were built to last. Some of those.
They were great.
Things.
I mean, it was big, and then we had those big, huge cameras, 3 tubes.
Yeah, 3 tube.
It was interesting. So then I started working part-time in the checkout, and then I went full-time. Then we did production. We had the van, the production van. We did every city council meetings and. Yes,
I remember I trying to lift heavy stuff with you, and there was competition.
Yeah,
we didn't care about our backs back then.
No,
it was kind of.
And
we had to keep up with the guys. So.
Yeah, it was no. We did. We did very good.
Yeah, it was heavy stuff.
Yeah, we banged the van a little bit once in a while.
We won't talk about that.
And then after that, well, I thought it was so amazing that the fact that MTN just, there was all that money that the city council at the time negotiated with the Rogers Cable, the cable company at the time. And I mean, we had a brand new studio, we had brand new everything, and it was to come and check it out, and you could take it home and do your shows, and you could go live. And I thought that
Here we are, going live again.
I know, and so I thought it was like amazing to me, and I said, oh, and then what was amazing to me too in Minneapolis, because I'm not from here.
And where are you from?
Oh, I'm from France.
I guess I knew that.
I'm from France. No. And yeah, I think you knew that. And so I thought he was, I mean, the First Amendment, and it was just so amazing that this thing was happening. And then the other amazing thing that I thought was going on in Minneapolis was their music. I mean, it was Prince and Willie Murphy, Willie and the Bees, and the Wallets. I mean, there were tons and tons and tons of live music. There still is, but I'm not as much in tune with it.
You're not at it all.
No, but I mean, and so I had the idea of starting a show, live show, because I didn't like post-production. I'm not patient enough for that. So that was called TC Musique. And my first show was June 8th, 1988.
Wow.
And now it's still going, 22 years later.
Oh my gosh, TC Musique.
Yeah, it's on
1988.
Thursday. Yeah. And I remember
Wow.
I said to the next producer, was Lloyd Jordan, and I said, whatever you do, don't give it up. If you don't want to do it anymore, because I couldn't do it anymore because I was traveling a lot. And now Art Roy has been keeping it going.
So just think of all the bands that have had an opportunity to play in Studio A and get their music out because of that show.
I know,
mean, it
and
is really
I know.
prolific. So
I know, and
thank you for doing that, Marido.
Good archives.
Yes.
And so then after that, when I stopped working for MTN,
Mm-hmm.
1998,
Wow.
I came on to the board. Like a couple years after, I needed a break.
Yeah. I think
Maybe
it was like 4 years.
4 years later.
4-year break.
And
then
then
you were ready to come on as a board member.
Yes, and I served on the board 7 years and became the chair for the last 2 years. And then now my term is up and I'm saying goodbye, but here I am. Back at MTN.
You're not going anywhere.
No, I'm staying in Minneapolis. I'll be probably doing more international business between here and France. And that was another thing too, is that that's what I like at MTN, is that there is so many diversity here. And you could go anywhere and people helped each other. And sometimes, I mean, their country where they come from is at war, but here it's like a sanctuary, you know, for expression and telling your stories and being heard. And people come after work to do shows and
To driving taxis. And
I know it's amazing and I mean, you know, the art, musicians. I mean, it's really an outlet for expression, and I really think it's very important for the heart of the community for it to be there. So that's why I've been always a big supporter of MTN.
Well, you've been a great supporter.
Well, thank
And it's
you.
been really good to have you on the board and to be able to count on you because you care about MTN.
Oh, yeah.
And you don't miss the important meetings or what needed to be done over the last year. So
No.
I just want to
Well,
thank you.
it's an important. I don't think that, you know, sometimes if you're from another country, and like if I talk to people in France about MTN, some of them say, "Oh my God, you are so ahead of us," because it's such a wonderful thing for people to be able to come and just, you know, express themselves and be on TV and it's very, very important.
Do their own thing.
Yep.
And if you want to do your own thing, go to mtn.org and find out about our free informational workshops and how to get involved in doing a show at MTN. And so now we're going to segue to our next guest. And Ann Queenen is our next guest. She's a producer of a series called Hazardous to Your Health. And we're going to take a little clip of hers and look at that while we switch things around in the studio live. So let's do that, Hamill.
We're all taking a closer look at access to the healthcare system in the United States. I thought I'd inquire about what access means to the Native American community here in the Twin Cities, as well as nationally. Meet Dr. Patrick Rock, CEO and Medical Director of the Indian Health Board in Minneapolis, and President of the National Urban Indian Health Council.
There's a lot of misconceptions, and that urban Indians get free care, or Native people get free care, period. Having those misconceptions, I think, carries thought that we're well taken care of, we're under the federal government's arm, and that we don't have any worries, and that's absolutely wrong. Well, I wouldn't be here if that was right. Well, we are what they call a line item in the Indian Health Service budget. Specific, it says Urban Indian Health. We get over the 34 programs, there's an appropriation of about $34 million that goes out to service the 34 other programs. That $34 million represents 1% of the overall Indian Health Service budget. So there's only 1% of the entire Indian Health Service budget goes to urban Indian health. 60%, upward of 60% of Native people per a census live in urban settings. So we get 1%, and we also get 60% of the population that we have to provide care for. So it is relatively underfunded programming.
To understand the relationship between the federal government and the Native American community when it comes to health care, it's necessary to learn the history. And I asked Dr. Rock to give us a brief synopsis.
I think of health care to Native peoples as a prepaid plan, is the way I look at it. Native peoples were being displaced into reserves that the federal government had deemed as land for Native people. Well, during the time period, our leadership, the chiefs of several tribes, had gone into a contract with the federal government, and these are treaties. These treaties are essentially written contracts that the government will, in lieu of displacing people off their land, that the government would instill a trust that would provide them with health care. You can read through them, and they'll tell you that as long as the birds fly and the rivers flow, that health care will be provided to Native people. It doesn't say how, it doesn't say to what degree, it just says health care will be provided for them.
And how would that health care be provided?
Okay, that's it.
Through the Indian
Here
Health
we are
Service.
back in Studio B with the producer of the series, Ann Queenen. Ann, welcome to MTN.
Hi, Pam. Thanks for having me.
Yeah, thanks for being here. So Ann, you started a lot of, you worked a lot of places in your life, but one of your last gigs was at TPT. Mm-hmm. And you left there a while back and went off to do your own shows and your own series here, Hazardous to Your Health. How has that transition been for you?
Well, in terms of being able to work on some programs that feed my soul a little bit, and it's been a good thing. Financially, it's a completely different matter. But I think you make that decision when you make those kinds of moves, and it was a move of passion for me right now. I wanted to be able to get some educational messages out there, and sometimes it's nice not to have to worry too much about the corporate sponsorship end of things or the advertising dollars that are going behind kind of a marketed message. With public television, that's a different realm, and they're pretty good about it. But you also have to watch there about, advocacy, and there are some programs like healthcare reform that, it's about human rights, and it may come across as advocacy, but it's really just getting information out there that normally I don't think you would see otherwise.
So you feel like healthcare is a bigger thing than just we're making it to be. You think it's a core right that all people should have?
Yeah, definitely it is a right. I mean, when you think about it, you don't. How do you say? If your house is on fire, you know the fireman is not going to say, "Did you pay for this size truck or that size truck?" I mean, you just get a public service. You have a right to your safety. We should have a right to our health care. They do it in a lot of different other countries, and it's just so difficult for us to do it here. And sometimes I think that just the information that's out there is not clear, and people need to be educated. And if they knew a little bit more of some of the information, it might help them make some decisions one way or the other, but at least get the information out there and not have it just one point of view.
Mm-hmm. And how did you dig into your series, Hazardous to Your Health? Where did it, how did you know what you wanted to do first? It's like a really complicated topic, and
well, I remember
especially during a complicated national time during the discussion,
it's
to be doing a series on it.
Well, I remember actually for a while when I got a master's in social work, I worked in a child psychiatric unit at Rush Presbyterian Medical Center. And you could kind of see how the system was working to get people in and out, or to get them to stay, or in order to get them covered by their insurance, they had to have this. And I don't mean to, there's just some systematic things that you could notice and waste that goes with that. And there's a lot of dollars tied in with that. And there's a lot of other people who need those dollars and those services. So I knew the need was there. At the time, they were trying to introduce the whole thing with Hillary Clinton. It didn't go over very well. I believe it was in '93. But I just knew that the public needed more information. So I was hoping to do that. And as far as the series at St. Kate's,
And Hazardous to Your Health is a series through St. Kate's? Or
it is being held at St. Catherine's, and they have helped finance it and help put it on. And it's also through the Physicians for a National Healthcare Plan. But the idea is to show not only what a single-payer camp could do or a single-payer healthcare approach could do, but also what is the difference between that and, say, the managed care approach and prevention approach that you're hearing about in other models versus what we have now, and what would happen if we just leave what we have now and don't touch it versus, and so we're just trying to distinguish some decisions and some information about those decisions when it comes to healthcare policy and get different points of view out there. So Physicians for a National Health Plan have been involved, and St. Kate's has had their own staff involved in it, and we've had immigrants perspective, and we've had a racial disparities perspective to access to health care, and we look at it from what it's like when you live in rural Minnesota and how easy or difficult is it to get access to health care there. And we look at it from the perspective of a small business owner and what does it mean, what we have now versus what we might have, and the various models that are out there. And since we started the series, things have changed a lot politically, and we're still not sure where we're landing, but so you have to kind of roll with that and yet try to see if you can get different perspectives out there.
What surprised you in doing interviews and talking to people? Is there anything that you just felt like you didn't think you were going to learn from it, but you found out?
I think at one point I learned that we as a country are spending, I hate to be quoted here, but I think it's close to 18% of our gross national product on healthcare. And I think that is more than double, sometimes triple, more than any other country is spending. Developed countries. And it's amazing to me that we continue to let a system, or a lack thereof a system, go on like this while you have these bankruptcies that are happening when someone gets sick because they can't afford insurance or they can't afford this treatment or that.
And I know from getting to know you a little bit, you seem like you like to ask people about their health insurance. Have you?
Did you notice that?
Have you? Do you have health insurance
I
since
do.
you quit your job? Okay.
Yeah, I do. I have it, and it's one of those. I think it's considered like a major medical, so I'm covered if the big dollars need to be spent, and meanwhile it's out of pocket for a lot of other things. But that was a huge decision, and that's one of the things we talk about in the series is a lot of people will not leave their jobs so they can hang on to good health care benefits, and I tell you what, they had them at TPT. It's a different ball game now, but
Right.
I'm pretty sure I got most of my cavities filled before I left.
Has it changed whether you're willing to go to the doctor or not now?
Oh,
That
absolutely it does. You bet. You count every dollar, and it's amazing when you call the doctor's office and you say, how much will that mammogram cost? It's hard for them to answer that. It depends on, well, what kind of insurance plan do you have, or are you paying, without insurance, or but
So
you
you're
need to know.
really walking the talk here.
Yeah,
It's not like
I am
you're
walking the talk a little bit.
really well insured and, So anyway, I think Hamill is saying that we might have an email question coming in. Here it is. I don't know what to say about this topic, or I love that you can email questions. Call. You be doing more of these interactive shows, Curtis. Thank you, Curtis. We will. That's why we're here. We want to do more interactive with you. So thank you for sending that. That was fun.
You didn't think you were going to get an email.
I know,
did
I
you?
got an email. And it's okay because we have lots of things to say, so it's okay that you don't, because actually most people have really big opinions on this, don't you find?
Oh, absolutely. I mean, it's a pretty loaded topic, but
Yeah.
what would
Because it's so personal, like, you know, and it seems like people are really afraid that they're going to lose their health insurance if, you know, if we do something to the system.
yeah, they are afraid, and
It's a fear situation. Where,
right, you don't want to lose what you're comfortable with, or and let's be honest, you know, there's money to be made with the system the way it exists for certain stakeholders, and
Right.
so you know, why would anyone want to set it up differently?
And certain stakeholders who might sponsor programming about your topic. So
Oh, you're getting right on it, aren't
that
you?
would,
Who have been clients of mine in
the
private
past.
business in the past. So
yeah, so that
yeah.
would definitely deter you from being able to do it quite as freely as you are using. You're playing your series in Minneapolis and in St. Paul and
Right, and
on MTN and SPNN.
yes, we are, and other local cable channels that are willing to play it in the surrounding Twin Cities area, and eventually we'll get some things out there on the internet too. But yeah, you don't want to offend anyone, and yet you do want to get information out there, and it's important for people to know that X amount of dollars are spent on marketing and advertising of those healthcare dollars that you just paid.
Well, yes. I mean, you can't even watch anything. I mean, I was watching with my two sons, and it was erectile dysfunction during, you know, an adventure show. And it was like my 18-year-old was laughing, and the 12-year-old was embarrassed, and it was like, wow, that is like a lot of the commercials. It's funny because then the end of it is like how you might die, you know, from certain kind of products.
Yeah,
it
well-
is amazing. I thought a visitor from another planet would find those commercials really odd. You know.
But you know, there's a place for everything, and we do need good products. We need good medical products. We need good drugs. We need, you know, there is a place for everything. It's just to have a system. Let's just be clear about what happens when you do have a system that's set up where the bottom line is driving your access to health care, and is there any way that we could maybe do it where money can be made, but also people can get access to health care at the same time? And I don't mean to be so over simplified, but it's nice to be able to take a look at different people's points of views and see different models that are out there. Like we had a program based on county-based purchasing, where it's a Medicaid managed program, and their Prime West Health, I believe, is representing several counties out in the state of Minnesota, and they're looking at that to see how that goes, because they've basically put all those publicly run programs, I believe, together to get more leverage for the dollar for their lower income healthcare recipients. And you know, it's nice to know that there's programs out like that, and let's watch them and see how they do.
Do you feel hopeful? Like, do you feel like that there is some motion in the ocean, even though in Washington there's so much feuding? But
I do
you
feel like it's
feel
been brought
like
out to the
people
public more, and people
wanna-
are starting to think about it. And if we can just be really careful about being very clear about information and addressing what people's fears are, and taking a look at it and seeing if we can maybe get some messages that are out there that speak to them and help them feel comfortable, and show them how it might look this way or that way. It's important. And getting those messages out it's hard to find channels. That's why MTN, SPNN, it's great to be able to come in here with a program like that and feel free to, you know, shape a message a little bit and get it out there, or have different points of views and have you welcome to it. So
yeah, well, it really is great for us to come across somebody like you who has, you know, a really clear vision of what you want to do and making the shows and wanting to play them. And so I think we feel lucky too that you
thanks,
come
Pam.
across us, because I think that more and more in the new media culture, our voices get amplified more if we, you know, get together and have the right channels, you know, in terms of reaching people. And more
Absolutely.
than ever before, we have these tools, you know, we have internet channels, we have public access channels, and,
Right.
you know, but I think we have to kind of ramp them up and make sure that people have access and get, you know, trained on how to use them and things like that.
Absolutely. I mean, it is empowering when you think about, you know, some of the citizen journalist efforts that are out there right now, and some of the, you know, people that used to think it would take thousands and thousands and thousands of dollars to get a program out. Well, this program cost, I think, $2,500. You know, and if I had bid it on it from a different umbrella or organization, it would be a completely different price tag. Now, I'm doing quite a bit of volunteering, and that can't continue always, but it is a powerful tool, and if you can realize that it doesn't take a whole lot on the producer end to
There's
get a message out
a lot
there.
of volunteer time, I would say.
Yeah.
Our folks here using MTN facilities and channels put in a lot of their own sweat and blood is really how it ends up working out.
Yeah.
So you're kind of a classic example of that.
Only 2 more shows to go.
But passionate about it.
Yeah, it's been good. I can't continue at this pace, but it's been good, and I'm glad to see the program get out there and to have some partners in the community who are willing to, you know, get the message out and put a program together, and you're one of them.
Yes, and I just want to remind people watching this that they can go to mtn.org and find out more about doing your own program, coming in and learning how to do something like this in the studio or edit in the edit suite. There's a lot of really fun stuff going on here at MTN, and if you're sitting at home and have always wanted to have a show, doesn't take too much. So, and how did you come to MTN? Did you know about us through the years, or?
Did know about MTN and SPNN as really good community access programs here in the Twin Cities, and seeing you on the air. I myself live in St. Paul, but
No,
I
you live in St. Paul? No,
so
we
I think
love
I see SPNN
to
more than
share.
yeah.
I mean, I also think that's really important for the future of community television, is sharing our resources, and
Absolutely,
sharing our thoughts and our programming.
absolutely.
And how are your potholes in St. Paul?
Hopefully not as bad as yours. I have no idea,
Okay,
but I know why you're asking.
all right. So anyway, I want to thank you for watching MTN Update and ask you to tune in next time. And I'll be looking at the right camera. So thank you to Hamill for all the work you've done to make this happen.